All right, let's go ahead and get started then. Hopefully we'll have even more people join, but at least we have a quorum. I believe I want to recognize the fact that it's Native American Heritage Month and see if we have somebody who would like to read the land acknowledgement. Any volunteers?
I'm happy to do it.
Who was that?
It's
That
Gwen. A long silence.
Thank you, Gwen. Go ahead.
Absolutely. So we recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge you as the past, present, and future caretakers of this land. It's on your traditional land where we partner to improve the health and well-being of all Central Oregonians. And we aspire to be good guests, honoring the concept from the Warm Springs culture that this is the land for us to live and know and pass on to the children. Oh, you're muted, Brad. Sorry.
Thank you. I want to remind everybody that we do our best to make our meetings welcoming and comfortable for everybody. Some of the ways we do that are to use simple language, avoid using acronyms as much as we can, just speak as plainly as possible, and don't assume that people know any particulars that you're talking about. If it's like lingo or agency specific or, you know. And, and we invite everybody to participate in the way that you're most comfortable participating. So you can speak up when the opportunity presents itself. You can use the chat. We'll do our best to track that. You can, I'm sure I'm forgetting something. You can raise your hand. You can use the little tools in Zoom to raise your hand, or say fantastic, thumbs up, whatever. Use those Zoom tools. And I would just ask everybody to help out in that regard as far as making sure everybody's participating who would like to. And let's see, let's move on to introductions. I'm gonna ask Kelly to help with that since I can't see everybody.
I gotcha. All right, so Brad will go with you first, and then we'll do Elizabeth.
Brad Porterfield. I'm the consumer representative and the chair of the Community Advisory Council.
Elizabeth Schmidt, can you hear me? Okay. I'm thank you, vice chair of the CAC and retired voc rehab counselor. Thank you.
Connor and then Mandy.
Hi, everyone. Connor Carlson, consumer rep, and I am driving, so I will be on mute for a little bit, but I will get on video soon.
Hi, everyone. Mandy Seeley. I have a significant lag, so hopefully I'm on the right timing. Consumer rep.
You're going in and out, Mandy, but we heard you. Thank you for coming. Miranda and then Tom.
Good afternoon, everyone. Miranda Hill with Klamath County Public Health, she, her pronouns, and I am a CAC member.
Tom Kuhn, Deschutes County CAC representative.
And Linda.
Linda Johnson on the board of directors, COHC Health Council, and community member.
Excellent. That is all of our CAC members that are in attendance today. I'd like to actually introduce Bradley Garner. He is on the Health Council staff now as admin. Eventually he'll be replacing my position here. So you will see his face every meeting now.
Thank you everyone for having me. I appreciate it.
And then everyone, Lindsay, would you mind introducing yourself? We don't see you often here. Just let everybody know who you are.
Hi, everyone. My name is Lindsay Taggi. I use she, her pronouns. I'm the Community Quality Coordinator at Pacific Source. I guess today, so thank you.
Thanks for coming. And then we have Jasleen as well. She's been here before, but Jasleen, if you just want to say hello to everybody real quick.
Yes. Hi, everyone. My name is Jocelyn Lopez, and I work for the Latino Community Association. Thanks for having me.
Excellent. Okay, I think that was everyone.
All right, and the others, just in case you're not aware, we had have an agreement on the Community Advisory Council to only do introductions for CAC members and guests who are kind of new to the group, and everybody else, you can introduce yourself in the chat. And we do that just to save time because we're always running out of time. But we're happy you're here. Now it's time for public comment or a patient story. So anybody who'd like to share a patient story or any comments? Anybody? Okay, I'm going to reach out and put you on the spot, Jasleen. You do not have to respond. You can say pass, but if there's anything you'd like to share about how, so Jasleen is a certified OHP assister, navigator. And I'm just curious if you have anything you want to share about how Healthier Oregon's been going or your OHP work in general.
Sure. I would say things are going really well. Just being though that we are also in the unwinding period, and doing, income verification. We are still having people be denied being over income. So we are having to refer people to places like Volunteers in Medicine. So just, I guess, just having to provide the proof of income is now, a big change, and can be tricky for folks who don't have really proof of income. And that's, I would say the thing that's really been trending for me right now is just those people that don't have that and having to do like self-attestation can be tricky. Thank you.
This is Jasleen, thanks. Anybody else, public comment or patient story? Alrighty, well, let's go ahead and move on. I need to let you know I'm challenged by bouncing back. I'm still on this Mac, which I'm new to, using a Mac. I'm getting back and forth. Thank you, Kelly. Getting between Zoom and the packet on my screen is challenging still for me. Emerging issues update. Gwen, are you gonna step in here or?
I am, and I'll ask Bradley or Kelly to project the little summary. This is just a refresher of where we've been over the last few years and some of the more recent developments. And what, to prep for the conversation that Brad will be leading a little bit later in this meeting. But this is just a refresher, like a couple of years ago, way back over on the left side of that slide, you can see that some of you identified dental and periodontal care as an issue. And so we reached out, worked with some of the DCOs and did some research with Pacific Source. That led to a meeting with the DCOs, which is the dental care organizations. So I'm not going to try and name them all on this gray thinking day, but all the Medicaid dental care providers. There was a lot of learning from both sides, from all sides around what's happening at the system level and how it impacts the client. And then from there, CAC decided to do some individual letter writing to OHA, advocating for some improvements, focusing on workforce development and reimbursement rates. In amongst there, we saw the CCO, Pacific Source, add some performance metrics in 2023 around oral health services, and another emergent issue that you had identified through the course of this, non-emergency medical transport. And then most recently, just a month or so ago, we had our annual combined meeting where the CAC meets with the board of directors, and you did quite a bit of work and discussion around working together on an emerging issue at the systems level. And there was a high level agreement that, yes, we want to do this. We want to build a process. And the request was that CAC identify and propose an issue to start with for the board, because this is a new journey of combining two bodies within the Health Council to really work together on something with the different strengths that each group brings. So that's the prep for the conversation today that Brad will get into. And then on the bottom left, you can see some of the other conversations that have come up through the course of time in emerging issues, which included chiropractic, non-emergency medical transport, and OHP call times, which have been resolved to the extent that they were able to at that time. Still, concerns, but there's been some movement with the dental and periodontal piece, and dental and what does this mean with the CAC and the board of directors partnering on those. So that is the update. Just a little refresher and prep for later.
Thank you, Gwen. All right, now let's take care of business as far as, did everybody have a chance to read the notes from our October meeting? And our job now is to just express if there is anything, speak up if there's anything that is either not accurately reflected or missing from the notes that you think ought to be. And if there's no one who speaks up, then we assume that they accurately reflect our meeting. So we'll take a minute to give y'all a chance. Action item there, add the shared issue and process to the November meeting agenda. We did that. We're talking about that today. Would you go back up just so we can see that list? I don't know if we're going to have something on the screen when we actually have our discussion, but those are the other issues that popped up in our breakout session in October. Dental, periodontal, that's already on our list. Treatment of patients by providers, so treatment, asthma, autism, opioid care. Okay, thanks. Streamlining opioid care. And then, yeah, we focused on our community health projects, making those difficult decisions. So good job again to everybody for all your work on that. It's a tough process. Okay, so last moment to speak up if you see anything that's missing or not accurately recorded. All right, let's approve those notes from October. And as soon as I figure out how to bounce back to, there we go. Input on December meeting. So we want to get, does somebody else want to lead this? Or you want me to go ahead and take it?
Brad, you can take it. And I'm going to put up a poll for everybody for the CAC
Okay.
members to vote on.
Okay. So I'll just kind of frame it, give context. So December, we want to have a discussion right now briefly about, and get your input, CAC members, on whether or not you'd like to meet, number one. in December. And if we would like to meet, kind of when, how long, some of those details will be in the poll. So let's just go ahead and hopefully that's enough kind of framing, and we can just go ahead and respond to the poll, CAC members, and then we'll see where we land. So the first option, attend the meeting on December 21st. That's our regular date. Attend an in-person meeting on December 21st so that we could share some food together. Cancel December and meet back up in January.
Brad, this is Linda.
Yeah.
I think the executive committee of the council has talked to Carmen about trying to arrange a social event with CAC, and the board is another opportunity for us. We used to do holiday parties. In the last couple of years, well, I think since COVID came, we haven't been doing those. I don't know where those efforts are in progress, but I just wanted to add that as one of the potential things that might be happening in December.
Thanks, Linda. That's a great reminder. We are working on the back side of that. The date is tentatively December 14th in the evening and in Redmond. We're working out and finalizing details. So if that information affects your response, just keep that in mind.
Yeah, that's good information. Are there still 6 of us, or has anybody else joined?
There's 7 CAC members and we've had 7 responses.
All right.
So it looks like 2 out of 7 would like to attend the meeting via Zoom on the 21st, 3 in person on the 21st, and 2 to cancel and come back in January.
Kind of helps us, kind of doesn't, right?
Exactly.
Well, I guess we can, let's have a conversation briefly around this. So let's see, who would like to just speak up and share your thoughts?
I guess I can switch mine to 21st in person, as long as food is being provided.
We'll definitely have food if we meet in person. Any other, who else would like to speak up about your preference? Is there anybody, I'll just try to help facilitate. Is there anybody who absolutely could not make an in-person meeting on the 21st?
Brad, this is Miranda. I may or may not be able to attend. I'm looking at my schedule now. I could potentially move a meeting around and make it, but if not, it might be a no.
Okay, and you've got a long way to drive as well, depending on the weather. Of course, the weather will impact all of us, but we'll always have a backup of a virtual. Anybody else? A comment on that? The in-person idea? I guess, let's do a 5-finger vote, since we haven't done that in a while. Let's exercise our fingers. And you can either put it in the chat or actually put it up on the screen. So 5 means you're all in on an in-person meeting on the 21st. Let's say a 2 or a 2 or a 1 or a none. Pretty much says no, I can't do it. So I see a 5 in the chat from Mandy. And again, this is for the in-person on the 21st. Just CAC and guests. We're gonna. So where does that help us at all?
We got 4s and 5s.
4s and 5s?
Mm-hmm.
Okay. Well, if there's nobody who's hard against it, I would love for us to try it. We don't get to see each other in person with Just CAC very often. So, and it's the holidays. It's a good time to share a meal together. All right, so let's go with that and hope it works out for everybody, as many of us as possible. And we're missing, how many people are we missing? 3? I should know how many CAC.
4 people.
4 people. So if we could somehow get input from them offline, that'd be great.
Yeah, I can send them a quick email.
Okay, thanks, Kelly.
Call, yeah.
All right, let me get back over to the other screen. Where is it? Okay, so that takes us to our CAC member small group breakouts. Oh, wait. Why did I not see that before? I didn't think we were doing a breakout session. What's our breakout session about?
Today, our breakout session is to think about the community health projects, the application and the review process this year. What do you think worked well? What would you change, evolve, or improve upon for next year? So what we're going to do is you're going to go into small groups for about 10 minutes or so to discuss. We are going to have a working document that maybe one person in your group can fill out. Bradley, if you could put that link in the chat. It's a Google Doc, so you'll be able to go in and make edits, and multiple people can go into that. So the first page is for room 1 to input their discussion topics, and the second page is for room 2. The link should be in the chat now if you want to just open that up, and I will actually share my screen to show you what that will look like.
The idea is just have one person open up that Google Doc from each breakout group.
Multiple people can open it up, but I think it would be
Okay.
best if only one person from the group input the information. So over on the left, things you felt worked well, would like to keep, and then on the right, things you would like to change or how we can improve. So room 1 is on page 1, scroll down for room 2 to input those. Any
I see what
questions on
the-
that part?
Question?
I was just gonna recommend, if the rooms are manually, if you want to read out the names, and I can throw them in the chat so folks know which page they're writing on.
Yeah. So let's see, I randomly split you up. In room 1, we have Connor, Mandy, and a Miranda.
Connor, Mandy.
Room 2 is Linda, Tom, Brad, and Elizabeth.
All right.
I'm gonna need some help getting put in room 2. Do I just click on it?
Yeah, I'll open up the rooms, Elizabeth, and it should really just take you there. You should be good to go.
Okay, thanks.
Yeah, and whoever is going to be inputting the information into the document, you'll want to share your screen so the whole group can see what you're inputting, for those who can't open up the Google Doc. Any questions? All right, we'll see you in about 10 minutes.
Good conversations. I hope the other group was I'm sure it was, just as rich as ours, as group 2. So how do we want to report out on this, Kelly? We just invite each, could put it up on the screen maybe, and
Yeah, I'll share my screen. And I believe we only had in this page, so I'm assuming everybody's is in here.
oh, good. That's easier to read.
True.
So maybe if room 1, if you want to speak up, either you have a spokesperson or just whoever.
Yeah, this is Miranda, and actually these are all of our notes from our group 1. So things that we, felt that we liked, we really liked that we broke up the counties into different groups, tried to focus on the funding by counties, thought it was more equitable because we focused on, breaking down those funding streams and also based off the need for each county. We love how organized you all are with the Excel sheets and the easy links to the applications and the score sheets. Like, really, really appreciate all of that. I know that takes you guys a lot of work, so thank you. Things we like to change or how maybe we can improve on was, we know there was a large amount of applications, which is good, right? We want lots of applications to come in, but was not able to break up the application batches like last year. We got like 10 at a time. And if you did those, then, you'd get 10 more. The amount of time to review application wasn't enough just due to the volumes. I know a lot of us have different things and different scheduling going on. So we did also mention, like, could we change that timeline? Is it a different time of year better? We also were kind of curious about clarity on like where the money is coming from and like timelines, like what's the fiscal year? Do we get this July 1st and we have to spend it by December? Just those things to kind of help understand what the timeline is. And then also in the future, we'd like to see a little bit more of project follow-up. I know this last year we got about maybe a couple people come in, but if that is something that's like required, that, hey, within 6 months, you'll come and give a quick presentation or just send us some kind of report so we can see that, and even potentially adding extra points for their next application. And then also someone mentioned, preferring kind of a sliding scale on you got 5 extra points, if this was your first time being funded, but maybe something like you get, 5 points if you were funded like 5 years ago, but you get, 1 point if you were funded, or 0 points, funded last year. So just kind of a different process was some of the feedback we heard here. So that was a lot of things, but we had some good conversations.
So that was all group 1, room 1. Good work. So room 2 is. Oh,
I can put it in as you guys are discussing or reporting out.
yeah, Tom wrote it somewhere.
I'll put it in the chat, and we just only did the things you would like to change, how we can improve.
Got it.
So, which very impressed by all the things the other group came up with for both. So, okay, so I'm gonna just kind of read through the list here because I took the notes, but have the rest of my group chime in for more detail. One of the first things was going into the planning criteria when we first started reviewing the applications. What are limitations for funding for what you can do? As one of our members felt like there was not enough beforehand knowledge of the funding limitations going into it, and that would have been helpful. And maybe that was provided somewhere, but maybe. Oh, I'm sorry, I didn't hit send on my chat. There you go. So, anybody from my group want to go in more detail about that, or?
That was Linda's, but for my clarity's sake, I understood it to be really more about the scoring criteria tool. Once CAC members start reviewing the proposals, that it be stated on that tool somewhere what cannot be funded. But Linda, if I got that wrong, say so.
For me, it's making sure that as we are finalizing the criteria, that we have some document in our hands that we can go back and check and say, do the criteria we're talking about meet the allowable uses of the funds? Is there any criteria we're setting that would be contrary to that? And then make sure that those, the parameters of what it can and can't be used for show up in the application for the people that are applying as well.
Okay. All right. Next one was the day we made the decision, we strayed from what was the criteria in the first place, and then straight to applications we knew and liked. So it seems like we didn't stick with what we were the criteria we were using in the first place, and it seemed like a preference for those that were previously funded. Any other clarification on that one? Okay, next one is we tried to limit the number of applications, but it didn't work. Can there be a pre-screening by someone else to reduce this, meaning pre-screening by maybe COHC or some outside source knowledgeable about grants that can go through and just really reduce the number. And also there was like, for example, there was a tri-county proposal, and there was only one tri-county proposal. It seemed like maybe that should have been in a different mechanism than this.
Just a tiny bit of something to add there was just that there were several applicants who had a proposal in all 3 counties. So 3 separate proposals, because their project was a tri-county project. And just to have to review the same proposal 3 times doesn't make a lot of sense. So.
Yeah. And then the final one, part of this was for me, just way too many applications to do a thorough review. And, you know, I did the Klamath County one to start because it was like 6 applications. And then when the request came to do the rest of them, I just looked at how many were there and I was like, I'm never going to be able to do this right now. I have way too much on my plate. And so I didn't want to review half of them if I'm not going to review all of them. So yeah, the volume is just tremendous. So there seems to be kind of a common thread running through all this. Either reducing applications or more capacity to review them.
Yeah, well, thanks everybody for that input. This is a conversation that will continue. So if you have further thoughts, jot them down or send them to me, send them to Kelly or Michaela when they occur to you. But again, thanks everybody for all the work you did, because it is a heavy load. And it's frustrating when you can't do it. You know, it's a task we all would like to be able to do. We can't all do it. So yeah, with that, let's move on to the emerging issue, or the issue rather, that have a discussion for the next, looks like we have about 20 minutes scheduled to talk about what issue we would like to tackle together with the board. So we took on dental, periodontal. Periodontal really started out as periodontal, expanded to dental more generally, but still not forgetting periodontal specifically. So that's the issue we've put the most energy into so far. I don't think, correct me if I'm wrong, speak up, CAC members, but my impression is that we're not all super thrilled that we've got a great outcome, that we actually made an impact. So I'd love to hear about that. Is that the issue that we would like to continue to focus on, since we've already put most of our energy there? Or is there some other issue that you think is more important, that we could be more effective and have more of an impact on? Just feel free to speak up or raise your hand, or however you'd like to participate.
If we, I mentioned autism, Paul Andrews is a specialist in autism. And, he works on the board, so I would think he'd want to pursue that. I don't know.
Elizabeth, I think that's a great idea. And Paul announced at our last health council meeting that he's retiring this spring, and he'll be resigning his position on the board in March.
Well, maybe he would just comment about that. If someone in the school district will follow up. I just would like his response, because there may be something positive that since he is retiring.
And I think we should focus on issues, and I'm not saying that autism isn't that issue. We should focus on an issue that, at least this is my thinking, that is not being served well by Oregon Health Plan, Medicaid. So if, like dental, for example, we've identified several areas in which Central Oregon Medicaid OHP members are not being served well in the area of periodontal and dental. So I don't know if that's, we could ask, certainly get input from Paula if that's the case with autism as well, or is OHP Medicaid doing a pretty good job of serving folks with those special needs? So that'd be a key question in my mind to answer first.
Well, what I thought we left, Gwen would know this, but with the periodontal, I think we have to work with the state, and it's not, I don't think it's over. I just don't think we've got to change OHP on that, and the state has to be aware of the negligence due to poor income for the providers.
For the
And-
low reimbursement rate. The low
Right.
reimbursement rate to providers.
Correct.
Yeah.
And the state can make a choice. I mean, maybe they're just gonna let it be what it is, but if we don't present it to the state the way you go about that, I feel that's negligence on our part.
So anybody else wants to speak up, please do so.
I like the idea of continuing with the periodontal discussion. At the end of our last board meeting a couple of weeks ago, actually Mike, I've forgotten Mike's last name. He used to be on the board, and he's from one of the other. Yes, Mike Shercliffe shared his thoughts, personal, not representing any dental group, I don't think, about different ways we might think about intervening to not just increase capacity for treating current dental problems, but also things that, from his perspective, research is showing that we can and do to decrease the amount of dental problems in the future. So both, I think, are equally valid. And so I think there may be room for further discussion and action, or maybe at least hearing some thoughts from Mike and others about that.
Thanks,
Good
Linda.
idea. Good idea.
Any other thoughts around either those two suggestions or any others? I'm gonna poke y'all. Mandy, I hope that's not, yeah, poke Mandy, Connor, Tom, who am I missing? Miranda, are you still there? Can't see everybody. Any thoughts?
This is Connor. No, none for me. I think what the group has said so far makes sense.
Thanks, Connor. Is anybody, oh, there's Mandy in the chat. I see, I'm having a hard time because of lagging. That's what that says. I would like to continue.
Pat, Mandy's putting in, I'm having a hard time because of lag. I would like to continue with periodontal because I'm personally affected by this issue still. Thanks, Mandy.
Thanks, Mandy. Yeah. Anybody else? Any other thoughts?
Go for it, Larissa. I see you waving.
Oh, Larissa.
Sorry, I just didn't want to interrupt anyone. I think that periodontal is a huge one. I also think that just access to care, getting in a timely manner. I mean, I know as an OHP individual myself and my child, I've had to wait 3 years for my CPAP.
Whoa.
I still don't have it.
What is that, Marissa? Sorry.
It's for sleep apnea. I
Sleep
stopped
apnea.
breathing at night. I'm a single mom with a kid who, like, that's not a good thing. I've been waiting 8 months for dermatology with no callbacks. My kid was going to have to wait 18 months in Bend area to get an autism eval. So we drove to Portland. I borrowed a car and drove my kid up to Portland because it was a 2-month wait. So dental's just as bad. I only saw a dentist while I was pregnant for once because in Central Oregon, they could not get me in another time. So those are just my personal examples, but I think it's an overall access. Like the systems are so bogged down with so many people and so little services that getting additional access is huge. And then knowing how to access that. Like I'm still waiting for reimbursements on travel. Not getting that either. So, a 2-year wait to see somebody when my child's having seizures should never happen.
Thank you for sharing that, Larissa. Yeah, I'm sorry to hear that. I'm guessing, is Kristen with us? That you and Kristen should connect.
Yeah, that would be great. If you wouldn't mind emailing me, I'd love to talk to you more offline and see if there's anything I can do to help. So I can put my email in the chat.
Perfect. I was just going to ask for that. And I was
Yeah.
also going to say I've worked with case managers at Pacific Source in the past, and they did everything they could to. So it's not a Pacific Source problem. It's a lack of providers in the area problem.
Although your 3-year, we don't need to get into the details, but the 3-year device, that issue sounds different to me. That sounds like a, what do we call that? The special, what do we call that, Kristen?
Durable medical equipment.
Mhm.
Is that what you were thinking?
Well, in that whole category of like special things
Specialists.
aren't covered by OHP, the
Flexible
funds?
funding.
Flexible
It's the
funding.
flexible funding.
Oh, yes. It's
Yeah,
sort of
Linda.
charades, but we got there. Yes. Yeah, if it wasn't covered by insurance, which it should be, the CPAP device, then flex funds could pay for that. But yeah, it seems like 3 years is about 2 years, 11 months too long to receive something like that. So if you can reach out to me, we can at least like look into that and see what's going on. Sometimes like durable medical equipment providers or other types of providers don't always call people to let them know it's in stock. But there's things like that happen from time to time, but 3 years still seems excessive. So yeah, please reach out. I'd love to connect with you.
Kristen, I just want to say that I don't think flex funds would cover it, just because the flex funds cannot cover anything with a billable code. So that there would have to look into other resources for payment on that.
That's a good point.
It's covered.
But if it was denied, yeah, I was going to say if it was denied, we could appeal it too. But it sounds like it's just a matter of not being able to actually get the device. So we need to figure out why that is.
All right, folks, thank you. Any other comments or thoughts around our issue we'd like to work with the board on to make some impact, some advancements, some improvements? Sounds like, correct me if I'm wrong, speak up if I'm misspeaking for you, but it sounds like there's pretty strong support for the periodontal dental because we've already put energy into that. We want to keep moving that forward. But we can absolutely ask Paul Andrews for his take on the autism topic as well, Elizabeth. But is anybody opposed to moving forward with the periodontal dental? We could do a 5-finger vote, chat/vote. So this is if you're in favor of moving forward with periodontal dental is the issue to work on with the board. either put your hand up in your screen or use the chat or speak up. Please.
Looks like we have all 4s and 5s.
All right. Okay. Thanks, everybody. Yeah, I just want to remind folks too that because I came up again just the other day that that I think we need to explore the possibility of reallocating our budget. So we've never really talked about the CAC having a budget and the Health Council more generally having a budget. But that's something I think we need to explore because apparently we do have some power around that, at least to express ourselves as how we would like that. I think that budget should be spent. How much should go to dental, how much should go to hospitals, how much should go to whoever, the different categories of providers. So I just want to put that out there as a kind of a first question on that topic when we start to meet with the board. That was raised in our combined meeting, that we might actually have the power to reallocate some funds to try to have an impact on an issue like periodontal dental, if funding can solve that.
Brad, just for clarifying, are you referring to the CCO budget or a budget that operational budget that you're perceiving that CAC has? So many funds, I just wanted to really clarify on what you're referencing.
Yeah, and I'm always trying to clarify that as well, but I believe it's the CCO budget.
Okay.
It's like the big pot of money. How does that get used in our region? Who makes those decisions? Whose voice impacts the priority of how that money is spent? Something we've never really talked about on the CAC. And I think to talk about that with the board makes a lot of sense to me.
Oh, okay. So I'm hearing looking outside terminology, because we know terminology as somebody who, anyway, just to make sure there's no confusion, what I'm hearing in general is a sense of how do we talk to the board and work with the CCO and the funds that are available through the CCO to also impact, and other sources, I suppose, to impact dental and periodontal. So
Yep.
kind of, okay. So I kind
How much is available? I have no idea.
Yeah, and I think it's a broader, I'm just going to say it's a broader conversation that pulls in a lot of folks that aren't at this meeting, and there's a lot of background to it that we probably need to get caught up with first to see where that scope is for us. So I think that's a great question, and I think that'll be a great question to start introducing to and exploring with the board as our partners, and seeing what that could or could not look like, what it's ready to look like in this space. So but I love that Brad's calling it out, and we can see, we can start by just asking some open-ended questions.
I'm not sure I still understand whether this is the different grant funding streams or whether this is the budget that Carmen pulls together for operations and staffing.
Yeah, and that's where I think there's confusion. I think there's a lot of different lines of funding, and I think Brad is referring to something that was loosely referred to in a previous conversation, and I don't want to add any more confusion around money.
Right.
Yeah.
I think we don't have that defined. And what Brad, what I'm hearing you refer to is there a financial influence that CAC can work with? And I think that is something that potentially can be explored. In the meantime, there's a lot of different, it's very complicated lines of funding, intersections that we would need to better understand in partnership with the board. So just want to.
Yeah, it's an educational opportunity.
Yeah. Let's not dive any deeper into that comment, because we don't have answers or direction. And it would be a whole new arena, valid and valuable. And we just, we can take that and bring that back for much more unpacking in the future, is what I would recommend right now. So,
yep.
Okay. Thanks, Brad. Yeah. And thanks for bringing that up.
Alrighty, well, thank you, CAC members, for all your input on that. And we have come to our final agenda item, which I can't see. It is, there we go. Findings and recommendations for the measure on belonging.
Yeah.
So Camila Dolman and Caitlin Green.
Yeah, I'm gonna jump in and do some introductions and a little bit of background. So Caitlin Green and Camila Dolman just came into the meeting. They have, and we'll do introductions here. I'm gonna give you some background. So as CAC members and guests know, we have these regional health improvement plan work groups who work to focus and improve some very specific health-related metrics from our regional health improvement plan. One of those work groups is the Upstream Prevention Work Group, and they identified back in 2020, 2019, the importance of belonging. And there had been historic work primarily in the school district around resiliency and belonging in our communities, especially with the youth and its role in mental health, relationships, safety. As a result of that initial work, the Upstream Prevention Work Group identified as one of their goals for this regional health improvement plan to develop a community level measure of belonging. And so the work group invested in that and partnered with a couple of our research entities in Central Oregon, OHSU Cascades and OSU, to develop a plan that included better defining and looking at what belonging means, developing a measure, like how do we measure it? What are the components of it? Completing that measure, so actually going out and gathering information, and then analyzing it and providing that back to us in the community with recommendations on where are things strong, where can they be improved, what is our role as a community partner in promoting and supporting belonging and the implications of belonging on overall health. So with that, I would love to welcome Camila and Caitlin to share some of the exciting findings that they have reached in this stage of the study and the partnership with the Health Council. So take it away.
Hi, everyone. Thank you, Gwen, for that really great introduction and providing a little bit of background on this project. We're really excited to be here with you all today. Let me see. I'm going to share my screen with y'all here. All right, are we seeing this slideshow, Community Belonging Measurement Project? Awesome, thank you. Great, so my name is Caitlin Green. I am the Central Oregon Community Research Liaison with OHSU, and I'm joined today by Camila Dolman, who is the project manager for the Community Belonging Measurement Project. And let's see, we've got brief presentation for you all today. We're going to go quickly through a little bit about our team and the project. We'll move through our planning and data collection process and then share with you some of these initial findings and what we are doing with those findings and our recommendations thus far. We'll hopefully have some time for discussion at the end as well. So like Gwen said, this is a collaboration between OHSU and OSU Cascades, and we also involve a lot of community partners in this work. Our goal is to develop and adopt a strategy for measuring belonging and resilience in our region, and we'll be sharing the findings with community members and community organizations to inform approaches to supporting and promoting belonging and resilience and improved health in our community. So this is just a very kind of high-level overview of our timeline. We officially started in January of 2022 when we conducted a literature review to examine how other communities and groups are measuring belonging. But then we really hit the ground running in July when we began our collaborative planning process. So I'm going to go quickly through that collaborative planning process, and a little bit about our data collection, and then Camilla will jump in to go into some more detail about our data and next steps. So we can also kind of see throughout this entire timeline that we've got a lot of involvement from community partners and community members at every stage of this project. We just kind of want to highlight that. And the collaborative planning process was where that all kind of began. We invited 21 community leaders who represented all the regions of Central Oregon, various identity groups and sectors to speak with us. And so those are illustrated here on this slide. Our community engagement approach allowed us to collaboratively develop and test data collection tools. It also created buy-in for participation in the project and helped us identify priority populations and also establish ways of effectively reaching out to specific communities. So here we see, we spoke with those community leaders and asked them to share their own definitions of belonging. So this is just a little representation of how we analyzed what those community leaders said and identified some common themes, which are depicted on the left-hand side of this slide. And then those themes were incorporated into the measures that we used in the survey. And those are depicted on the right-hand side of this slide. And then also before our focus group, we hosted community conversations with community members to inform the development of our focus group guide and to test some potential questions. So here's just a kind of screenshot of one of our activities. Those sticky notes on this slide are our community leaders' answers to a reflection question about identity and belonging. And we use this input to develop the questions in our focus group guide. So we started our data collection in early 2023, early this year. And I will talk about that briefly next. So we as you're probably gathering, we used a survey as well as focus groups to collect our data. And our survey was available to adults 18 and older, and it was in English and Spanish. And our focus groups were conducted with priority populations that were also identified through the survey. So what were the results of our data collection? We had a goal of reaching collecting 1,000 responses, and we met that goal. About half of our responses came from the mail outreach that we did, so through an address-based sample, and then about 48% of our responses came from the community outreach that we did. We leaned on a lot of community partners to do outreach, to engage folks in our survey. And then we also conducted focus groups with individuals from the LGBTQ+ community, parents, caregivers, people living in rural settings, elders who are 65 years and older, Spanish speakers, and then also because of our kind of lower than expected participation in the survey from young people and also men, we conducted 2 focus groups with those priority populations. And I will hand it over to Camilla to dive into some of the initial results from the survey and our focus groups.
Awesome. Thanks, everyone. Excuse me. Yeah, so thanks, Kaylin, for providing that quick overview of the planning process and data collection. We think that's just super important level setting, so you know how we got to the results that we're going to share with you today. So let's go ahead and go to the next slide. So just to share a little bit about our survey demographics, the demographics were broadly representative of Central Oregon, but there are some discrepancies which we want to acknowledge. For example, as Caitlin alluded to earlier, there was a much higher response rate among women compared to men. So you can see that only less than 1/3 of our respondents were men. But we also achieved some of our goals of achieving overrepresentation of minoritized communities. So Central Oregon's about 88% white, but our sample overrepresented Native, Asian, Native Hawaiian, and Hispanic and Latino or Latina individuals. Moving on to the next slide, we have a breakdown by geography. We also have a breakdown by education and income. So our sample did overrepresent folks with bachelor's degrees and graduate degrees, and underrepresented those with high school or less. So you can see only about 10% of our sample had a high school degree or less. And then for income, we did pretty well. The median household income for Central Oregon is about $76,000 a year, and the median for our sample fell in the $50,000 to $75,000 range. Moving on. So one of the first questions we asked participants were to identify groups or communities that were important to their sense of belonging from a multiple choice list. So the first question just asked them to select all of these groups that they identified with, and then they were also asked to select their top 3. So you can see that the most frequent responses were family, hobbies and recreational activities, followed by lived experience and coworkers. And people, often chose these for their top 3 as well, with family being far and away the most important. And we like to highlight these because we think that they represent areas that are potentially high leverage for interventions when we're thinking about how we can continue to support belonging in this community. And then next we asked participants to identify places and spaces that are important to their sense of belonging. And again, this was from a multiple choice list. And good news, people feel that where they live is important to their sense of belonging, followed by where they're from or where they grew up, which for many would be the same as where they live, but not always, and workplace being identified by about half of the respondents. And then going to sort of those belonging metrics that we mentioned earlier, these were co-developed with community members and include constructs such as safety, inclusion, reciprocity, so feeling like you are both giving something to your community and able to get something back, having influence or control over decisions made in the community. So you can see that overall, people, for the most part, somewhat to strongly agreed with most of these statements. The exception is the one at the very bottom, which is I feel like I have some influence or control over decisions made in my community. That was a pretty low scoring item, with only 31% of folks agreeing with that statement. But we think there's a lot to be proud of here. People generally feel that they have a lot to give to their community, that there's a lot of activities here that serve them. There's people in the community that they can talk to about their problems, and they generally feel safe. So again, just diving into some of those items that we want to highlight. Almost 3/4 of respondents somewhat or strongly agreed with the statement, I feel safe in public spaces in my community. We think that's, really great. 70% of respondents somewhat or strongly agree that they believe that they have a lot to give to their community, demonstrating that we have a lot of assets here in Central Oregon. And then on the, more areas for improvement side, only 31% of respondents somewhat or strongly agreed that they feel like they have some influence or control over decisions made in the community. And so why should we care about belonging? And why should the Health Council be caring about belonging? So we see that belonging is really closely related to health. So this plot shows that the average belonging score by self-rated physical health, which you can see on the left-hand side, goes from poor to excellent, and then belonging scores, which are the average of each of those items shown on the previous slide. And we can see that the average score increases as self-rated health increases, sort of demonstrating that there's a linear relationship between these two factors. And then moving on to self-rated mental health. So here we see a pretty similar relationship, whereas people's self-rated mental health increases, their belonging score also increases. And we looked at a lot of different demographic factors in this analysis. but the association between belonging and health was stronger than any of the other relationships that we looked at. And that includes the relationship between belonging and geographic location, age, income, employment status, and several other demographic variables. So I think this really highlights that belonging is an important area for our communities to focus on, and that we should be considering belonging as a social determinant of health, and improving belonging in Central Oregon has the potential to really profoundly influence health. So moving on from the quantitative findings, we also wanted to share some of our qualitative findings, which can provide us really valuable insights into what we can do about the gaps that we do see in our community. So these are the sort of researcher takeaways of responses to both open-ended questions in our survey as well as focus group data. And we will be and have been using this to sort of guide community interpretation with community members. So the responses that I'm going to show are answers to questions like, tell us about a time you did or did not feel like you belonged in your community, and what are some things you do or don't like in your community, and things like that. So I'm just going to highlight two sort of areas of findings, one related to parenting and raising children, because we saw that family is super important for belonging, and we also saw in some of the qualitative responses that there were a lot of gaps here. And then I'm also going to talk about workplace-related findings, because we saw that as another area where people are getting a strong sense of belonging, but that there may be some areas for improvement. So we found that while family is a primary driver of belonging, parenting itself can often be a socially isolating experience and lead to shifts in social networks. And parents also identified a need for enhanced recreational opportunities and better infrastructure, including sort of family-friendly spaces to support raising children. I'm just going to share some illustrative quotes that are associated with these themes. And now for the need for better recreation and infrastructure. And finally, sort of a lack of family friendly or welcoming spaces for children in the community. And I would be remiss to mention that many strengths and assets were also mentioned, and that there are many resources that are available in our community to support parents. So here's a quote illustrating an example of that. So what are our, priorities or suggested takeaways? For the Health Council, we really recommend partnering with and continuing to fund family-serving organizations or those that support new parents, recognizing that this is, an area of need in our community. For us all to sort of advocate for accessible recreational opportunities for kids, as well as kid-friendly transportation networks to get to school or recreational activities. Working with businesses or business organizations to build in family-friendly practices or spaces, making sure that, families feel like they're welcome to go out in the community and don't have to worry about their kids not feeling welcome in a given space. And then building on the assets and past initiatives that have worked in Central Oregon. So we know that Traces used to support children in foster care with accessing recreational opportunities, and we think that would be a really great program to bring back. So I know I don't have very much time, so I'll try to go through this quickly and You'll have a version of these slides as well. It's a little bit updated since then, but diving into belonging in the workplace, we know we spend like a third of our hours alive in the workplace. So this is super important. They're major outlets for social interaction and social connection. And about half of our respondents shared that work or coworkers give them a sense of belonging. However, we are experiencing challenges to that sense of belonging. And some of those are related to the COVID-19 pandemic, which sent many of us into home offices or left us in very stressful environments if you were a frontline worker. And then also differences in identity in the workplace can sort of present barriers as well. And then finally, retirement or the anticipation of retirement is really impactful on older adults. It can shrink their social networks and also lead to a search for purpose. So here are some quotes about strengths in the sense of belonging in the workplace. Feeling accepted, building relationships, and as well as feeling comfortable sharing ideas and opinions. And then on the flip side, feeling like you're not accepted, that your workplace, sort of centers the dominant culture, or that you're excluded because of race, ethnicity, or age. And finally, that retirement is a barrier to connection, and that folks who are planning on retiring soon or have retired are unsure of how to stay connected and may lose sort of that sense of purpose. And now thinking about suggested priorities for the workplace. We think it would be important to partner with or develop grants for workplace serving organizations like chambers of commerce, professional interest groups, co-working spaces, and others, to consider strategies or initiatives that could ease the transition into retirement and promote social connection for older adults. And then sort of marrying the findings about retired individuals with those of the parents and children, consider opportunities that could promote intergenerational learning and engagement to the benefit of both retired adults and children. And then I'm going to pass it back over to Caitlin so she can quickly talk about what we're doing now.
Yeah, thanks, Camilla. So Camilla shared that our initial findings suggest that there are many intervention opportunities for community groups to address disparities in community belonging through program planning and policy implementation. So we, of course, plan to share the findings from this study broadly with the community, but we also know that data and data collection is not inherently unbiased. So prior to producing any reports on the findings, our team is collaborating with community-based organizations to co-create meaning from the initial findings. And we're doing small group community input sessions to do that. So we are collaborating with 5 community partner organizations to uplift the voices of priority populations that were identified in our research. And participants in the community input sessions will describe the meaning of patterns that they see in the data from their own perspectives, and then also share how they think the data can inform future programs and policies to promote belonging and resilience in Central Oregon. They'll also provide some input on how to disseminate, how to get these research findings out to the community and to community-based organizations. These are just a few examples of folks that we've reached out to or will be partnering with that you see here on the screen too.
And finally, just talking about next steps. We are sharing findings in settings like this at both the community level as well as at the national level. So earlier this week, I presented our project at the American Public Health Association conference in Atlanta. And we also had a presentation at the OPHA conference. And then we're also partnering with the St. Charles Community Benefit Department for remeasurement and in support of their initiatives to promote belonging. So it's 1:29. I'm happy to stay on and take any burning questions that anyone has. or to connect later on if folks are interested in learning more.
Thanks, Caitlin and Camila. Are you able to share your presentation with us?
Yes, we can. And I see your comment in the chat, Brad, and we did engage with folks from LCA and the Fathers Group in the community planning process. And we're working with Gender Hive to do our LGBTQ co-interpretation session, and Better Together to do our co-interpretation session with Spanish-speaking individuals.
Great. Great.
Have any plans to publish this information?
Yes, we do. So I have slowly been working on a paper sort of about our measure development process. And then we also plan to publish in academic journals findings from our study. And then also after co-interpretation, think about how we can disseminate in ways that are going to be effective for community members. And will somewhat be informed by the findings from our co-interpretation sessions.
And I think the big reason, when Camilla touched on one of the big reasons that we wanted to bring this to CAC as they finalize and do the co-interpretation is to, ask CAC support and disseminating. They called out, workplace support for this and other places and ways that the network of Health Council partners, which you are one very important piece, can help support bringing this back to consciousness and taking action on it as a broad community and region. So that's the ask.
I could recommend
right now, but
I could recommend presentations to the 3 local Rotary clubs. So if we wanted to ask for one of you to come and speak and give this presentation to Rotary Club, would we go through Gwen? How do we contact you?
Yeah, Gwen, I can share my contact information in the chat, and that's the best way to reach me. And yeah, we're happy to continue to do presentations on this topic and share with interested groups in the community.
Well, thank you again. I just want to acknowledge that our time is up. I do have one question, but if anybody needs to go, you're obviously free to go. Just want to make sure you feel comfortable doing that. My question is, what is remeasurement? What do you mean by remeasurement in that last thing with St. Charles?
Yeah, great question. So acknowledging that this is just a point in time assessment. So we collected data from January, or we collected survey data in January, February, and March of this year. And then the focus groups we did over the summer. So to understand, hopefully, right, like this is going to drive some movement on belonging related initiatives. We know that St. Charles specifically is actually putting funding behind initiatives that are supposed to support welcoming and belonging in Central Oregon. So the goal for remeasurement is to do the same thing in a year or in 2 years to see if, we're seeing any movement on these items. Or if not, understanding, what do we still need to do? There's also like plenty of sort of environmental factors or other changes in the community that could be going on. Hopefully nothing like COVID again anytime soon, but we know that really impacted folks' sense of belonging. So it's important to continue to collect data on this in order to just have a pulse on what's going on and make sure that this stays fresh. Of course, it's also equally important to act on the findings and not just collect data for the purpose of collecting data.
All right, anybody else have a final comment or?
Just amazing research. Thank you, Camilla and Kristen. I know what it takes to get all this stuff out there, and definitely no surprises on my end for what the findings were. So just really appreciate it. And what work group again was this elevated from? Was it the behavioral health?
No, it was the upstream prevention work group.
Upstream. Okay, great.
Around resiliency and belonging, yeah.
Great. And the other sponsors around it outside of COHC?
So the initial research was all funded by the Health Council. We are getting a much smaller grant from St. Charles to do the remeasurement piece.
Lovely. Thank you so much.
Thank you. It's nice to see you again, Carmen.
All right, everybody. Well, enjoy the rest of your day and week and have a great Thanksgiving. We'll see you next month.